أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. I'd like to welcome you all to this first class in our Hijama cupping therapy and traditional African medicine, medical science. This is a joint class for those who are taking just Hijama cupping therapy and for those who are taking traditional African medical science. And along the line, we would break the class where these both different specialties will be taken by various students in the classes. For those who are doing the combined course, then they'll be attending all the courses and like that. But where we have those doing cupping and not doing traditional medical science, then they would attend the classes only related to cupping. And same for those doing traditional medical science, they would attend those just for medical science. Where there are similar courses or courses that are run by both units, then inshallah we would have it as a combined class as we go along. I would like to welcome you once more and remind you that what you have chosen to do, this path you have chosen to follow, is a noble path. To heal people, to want to heal people, is a choice that one makes and lives with it. If the operative word here is if you have chosen to join or learn this to make money, then the news is it's not one of those fields that would make you a billionaire, except of course if you're destined to be a billionaire. But where you treat people with holistic medicine, you find out the compassion, the care in you will not let you bill people exorbitantly, or it's not a path to make money. But if you join in wanting to heal people, to reduce pain, to make life a little more comfortable for those who come across your path or whose path you come across in seeking health care, then you would make some money. But in addition to that, you become wealthy. Now, there's a difference between being rich and being wealthy. Richness has to do with money. Wealth has to do with peace of mind, reaching out, and good health. So you find people who are wealthy have some money. They might not be stinkingly rich, but they have monies to meet their needs. They are healthy within all relative terms or quotes of being healthy, and they have peace of mind. They sleep well. They don't go under the bed when they hear children playing with bangers, and they have a quite comfortable life. So you're wealthy, you breathe well, you eat well, you go to the toilet yourself. It's all part of wealth as far as we're concerned in traditional medicine. Wealth is not just based on money. But where you are looking at being rich, you could be rich and very sick, rich and without compassion, without empathy, and so many things. But we'll discuss that as we're going into the program as one of the causes of sickness and how to cure those kind of sicknesses. Now, as you plot this graph, as you plot this path, you would have to keep learning and learning. Sometimes you will unlearn and learn, unlearn and learn, and then you keep going. You have to keep developing yourself. What we are going to be giving you, in essence, is the foundation, that you have a sound foundation, that you're built well to go. And every other thing you put on that, you'll be able to know which is right and wrong, and why it is right and wrong. And inshallah, one day you'll become one of those consultants we are hoping to have around, who will be manning the hospitals here in Nigeria. Having said that, I would like to go through some of the things that we will be looking at with all of you, and inshallah, a breakdown of it to see how it will go. And sorry, trying to get this here, and we to get the, let me get the slideshow going so that it'll be quite large. So, well, like I've already said, welcome to Shifa Holistic Healthcare, where we'll be offering you these training programs. We are MBTE approved, National Board for Technical Education. So our diplomas are nationally approved. We're an NSQ training provider that have been assessed and approved by them. We are also IPHM accredited as both trainers and practitioners. Now, as trainers and practitioners, we train, we practice, so we have a clinic. At the end of the day, for those of you who are in Kaduna or who can make it, we'll be coming to a sort of teaching hospital that we have where you'll be doing your clinicals and get exposure to various treatment procedures and co. This diploma that we are running is a diploma in traditional African medical science and Hijama cupping therapy. We offer 2 levels of diploma for Hijama. This is this basic, the first diploma and an advanced diploma that we offer. And for traditional medical science, we offer 3 diplomas. The first covers level 1 and 2 of the NSQ certification, while the second covers the 3 and 4, while the third covers the 5 and 6 levels. Level 5 and 6 gives you the equivalent of national diploma and higher national diploma, respectively, and tagged to the degree BA. So by that time, you'd actually be ranked minimally as somebody who has an MBBS, who has studied medicine, or a little above that once the cadres are set properly. For now, these certifications have been accepted level 1 to 6 by the Office of the Head of Service Establishment Unit. It's been gazetted, so you can be employed with these certificates, and you can even go for NYSC for it if you've not gone to NYSC before. So this program will take you to that level. So this course, of course, like we said, is for those who want to learn a holistic health way of treating ailments as a skill and a profession. As a skill, because traditional medicine is seen as a skill, a specialty. So you find in our various villages or towns across the world where you have traditional medicine people, they come mostly in families where you have one house known for bone setting, the other house maybe they are known for obstetrics and gynecology, where they are those that deliver the babies and go. So once the child to be delivered, they go to that particular house. Some others, it's for the fertility part of it. Some others for different things like that. There are those who just do skin treatments for various ailments. And so it's like a specialty per house that is now being merged together. This is what the allopathic medicine people saw, and they just tried to put it under a roof, and then they now ask you to go for specialties. Hijama itself is a specialist treatment that is found in traditional Chinese medicine, it's found in traditional African medicine, and it's found in Unani medicine. So it's a specialist course, just like a lot of others will be meeting, but since it is something that can be given on its own, we give that. So you see, those who want to use holistic traditional healing as a way of healing or treating ailments, as skilled professionals like that. So we keep saying holistic. When you talk of holistic healing, holistic health, you're talking about treating the body, the mind, the soul. So they say body, mind, and soul, or mind, body, and soul. It goes a little bit above that, because you're treating general wellness, peace of mind, and so many other parts of that mind. The soul, the spiritual part of it, and the non-spiritual parts of it that are binding. And of course, the body, the various aspects to do with it. So you're trying to treat somebody as a whole. There is a saying that what affects the nose affects the eyes. So each part of the body is linked. For those of you who are practitioners who do traditional Chinese medicine, depending on what level of knowledge you have, you would know there's the Tung balance method, there's the law of opposites in balancing, and so many others that you treat various parts of the body from different parts and you get that wellness you need. So, yes, these are things that you treat as a holistic health practitioners. So, it's open for those who want to just learn it, or those who want to learn a Sunnah way. Sunnah comes in here for those who are studying Hijama cupping therapy. Cupping therapy in itself is a very old therapy. Nobody would tell you when it started or where it started or who started it. The most we have is documented history that goes about 3,600 years in the Chinese peninsula. And we have that in the Arabian Peninsula, which is a bit younger than that, dating about 2,700 or so years. That is written history. We're not talking about the oral or how it came down, we're just where we can find some documentation and things like that. And I'm sure as archaeologists keep discovering things, we might find out more coming up like that. But then the sunnah part is that in Islamic medicine, it comes in as a sunnah, which means when you do it, you're the therapist or the therapy, you get a reward. It's like performing a religious act or duty. Yes, we wish and we hope, we look forward to having doctors, physiotherapists, nurses, acupuncturists, and other traditional medicine practitioners, holistic healthcare therapists, and co to come in, build confidence, use alternative methods. The drive of World Health is to go into drugless medicine. And the only way you go into drugless medicine is using food and nature as your cure, so no side effects as you would get with allopathic medicines. So while you're trying to treat a patient with ulcer, you don't turn the lady or the man into being infertile because the side effects of some of those ulcer treating drugs results in infertility with all tests showing normal, but the person is infertile. So you want to treat with no drugs, you want to treat the person holistically. Some ailments don't need any medication, they just need some talk, like we'll say some nasiha or some counseling. That's all that is needed, nothing else, and it's something that is open. If you do therapeutic massage, cupping massage is very, very therapeutic. It's something that you should look at learning. If you want to be certified, you have prior knowledge. NSQ certification looks at your prior knowledge and certifies you. If you are qualified instantly, you get your certificate instantly. If you are deficient in one field or the other, they don't ask you to repeat. They just ask you to build on that deficiency. So if you're being assessed on 8 components of a point of a certification and you are competent in 6 but deficient in 2, you would only have to make up for those 2, go learn them and come back and pass your grading and code. So, like I said, our courses are certified, IPHM accredited, sorry, IPHM accredited and certified. So it gives you access to be a member of this prestigious international body whose certificates and accreditation are accepted in over 100 countries around the world. I don't want to give a figure so that you not tell me that I was too short or too high with 2 or 3 numbers. So, but it's over 100, I know, about 120 something. All Commonwealth countries recognize them and a few other that are not Commonwealth. And of course, we have NSQ certification. The Nigerian Skills Qualification Framework, or the National Skills Qualification Framework, is a system for the development, classification, and recognition of skills, knowledge, understanding, and competencies acquired by individuals, irrespective, this is a key word here, irrespective of where and how the training or skill was acquired. The system gives a clear statement of what the learner must know or be able to do, whether the learning took place in a classroom, on the job, or less formally. The framework indicates the comparability of different qualifications and how one can progress from one level to another. The NSQF is structured within the National Skills Qualification Operate. So it checks your prior knowledge. It doesn't matter if you've been in a class or not. So at the end of the day, our students will be certified, inshallah, using their native languages if they chose to. So if you spoke Igbo and you want to be assessed in Igbo, they will assess you in Igbo. If you spoke Hausa or Yoruba or Tiv or Baju or any other language, Fulfulde, Kanuri, Ijo, whatever language, you'll be assessed on that language, with that language, and you'll be certified. So, like I said, this qualification is for those interested in developing a career in the health sector and for the award of NSQ certification. The certificate for NSQ is for the traditional medical science, and by the time you are certified at level 2, you will be equivalent to a traditional medicine practitioner 2. So you see, and this we pray very soon will be accepted in our teaching hospitals and various hospitals, that we have a desk for people who are so trained. So there's more you can see on the documentation for NSQ that reflects the levels. It's from 1 to 9, and it's been integrated. Also, you can go from just having one certificate to a PhD. In that, you get your PhD by assessment. So you just do your write-ups and things like that. Once you meet the criteria, you're good to go. So, To start our program, we'll be setting down certain ground rules. Number one, try to attend all live classes as best as you can. Number two, where you miss out to attend a live class, the link will be given in the class group. So you would watch that video for that class. Number three, you will make your notes. You will make your own notes and write them down in a way where you can read and bring it up where needed. Number four, you will do your assignments. After every module, and in some cases, somewhere along each module, assignments will be given. It is expected that you will do these assignments and submit them. It is very key because it leads to number five, where not doing your assignments could delay your graduation. Because if you don't do your assignments, you cannot be assessed. If you cannot be assessed, you will not be given a certificate. Number six, ask questions where you do not understand anything. Ask questions. If necessary, a special class will be taken to answer those questions if it is beyond answering in one of the sessions. Ask questions, send your questions in. It is very, very important. Number seven, is it, or number eight? We expect you to be able to come in for some practical classes. For those who do the course fully online, then of course, at the end of the day, your certificate will indicate that you were not in class for the clinicals. So for those of you who are in Nigeria, who can come into the class in Kaduna, then we will expect you to be here when it's time for the practicals. The date will be given, it's normally towards the end of the program, where we coming to do practical hijama classes, coming to do practical classes for traditional African medical science, diagnosis and some formulations and identification of plants, things like that. So with these ground rules, we would pray that they are adhered to, and we will continue discussions for today. Like I said, today is the first class. It's an introductory class, just to run you about things we would be doing, and we would be talking about. The groups would be three groups: Hijama group, traditional medicine group, and a combined Hijama and traditional medicine group. The idea is so that you see that is for you and attend the lecture that is for you, and any information given that is group related will be for those in those particular classes or groups. So, disease and sickness. In traditional medical science, disease is as a result of imbalance in the naturally existing temperament. Here we can use the word balance too, of the body. The change can happen at the system, organs, tissue, cellular, mental, emotional, or spiritual level in the human body. So, disease or sickness is normally defined as a change in the body, mind, and soul, or a degradation that is beyond the accepted normal. would correct that. It's actually mind, soul, or a degradation. The and there would go, but essentially what we're saying is that any change in the body, physical body, cut, swelling, trauma, is seen as sickness. The mind, that peace of mind thing, for those of us here in Nigeria, you find out we try to translate this mind thing, mind and heart take the same meaning in most, or same word in most of our vernacular. In Hausa, they will say zuciya. Zuciya is mind and zuciya is your heart, physical. So you have the heart and the heart that is non-physical. So you hear people in Pidgin English talking about their mind. It just spoiled my mind. That just vexed me. My mind just, and that mind, it's a mental thing, and the mind has spoiled. The mind is linked to the body, where the heart will go into where the mind is hosted, and where the soul is hosted, according to traditional medicine, where the essence of life is, and all that. So, beyond this, is that we see everything possibly as sickness once there's an imbalance. Hunger is a sickness. So you find people telling you a hungry man is an angry man. So you try to avoid certain people at certain times. Being broke, poverty itself is a sickness, especially when it extends. You find out it causes a lot of issues for the persons involved. So all this, and to balance it, you find out some treatments, like I said, are not herb. It could be just counseling, and it could be just solving the problem for the person. So we now know what traditional medicine looks at disease and sickness as, and what they classify it as degradation that is beyond accepted normal. You find out some people fall sick because they believe they were not accorded the proper respect when they went somewhere. It becomes a very big issue, sometimes family, sometimes communal, that he or she went and she was disrespected, they were disrespected, this happened, high blood pressure, stress, serious, all that is seen as sickness as far as we are concerned, in our own diagnosis. So, as for Hijama, like I said, this is an introductory class, so we're looking at everything as it comes. Anas ibn Malik radiallahu anhu reported that Nabi sallallahu alaihi wasallam said, indeed, the best of remedies you have is in cupping, which is hijama. He got it practiced on him and he did it. Another hadith from Abu Huraira said, Nabi sallallahu alaihi wasallam said, if there was something excellent to be used as a remedy, then it is cupping. It is in cupping, hijama. And science now is backing this up, that there are so many things that hereto were difficult to treat, but with cupping therapy, you just treat without even giving medication, just treat and diet control. But everything is fine and the person is getting better. So, yes, science is researching it. They're finding there are a lot of journals coming out now, bringing prints out. Hijama can do this, Hijama can do that, there's this, there's that. Cupping therapy from traditional Chinese medicine. So it all does that. The only difference is the intention here. So all of it, like I said, Hijama falls under traditional African medicine. It falls under traditional Chinese medicine. It falls under Islamic medicine. It falls under Unani medicine. Here locally, in our traditional medicine, in the Hausa culture, they have it, they call it Gaho. in some other places. I don't know what they call them, but I'm sure before the class is over, those of us from different parts of the country will be able to say what it is called in their language, and will update our notes and our write-ups. So, African traditional medical science. It refers to the sum total, the sum knowledge, the total sum knowledges, the total of the knowledge, anyhow you put it, skills and practice based on the theories, belief, cultures, and experiences indigenous to different communities in Africa, explicable or not. This word here, this explicable or not, is a point to note. We'll be coming up and down on it as we go in. Used in maintenance of health and in the prevention, diagnosis, improvement, or treatment of physical and mental illness. Most of this knowledge are transmitted from generation to generation orally and are divine in nature. So, the traditional medical practitioner is then one who has the skills, who has knowledge of the theories, the culture, the experiences, indigenous to his own community and other communities probably, who is trusted by his people to do that. Now, inexplicable is something you can explain. Inexplicable, you know it works. We all pray every day before we leave home. God, take me safely. Come, bring me back safely. God, protect me from this. God, let this happen. This. And we see the thing happen, but we cannot explain it. We just say it's God that did it like that. It's inexplicable. The same way you might not be able to explain how putting a leaf on the skin cures an internal organ, and so many other practices that are there. As we go in, you come to see it. A lot of you would have seen that too. So, at the end of the day, the class will be broken, like I said. Those who are just in Hijama, those who are just for traditional medical science, and those who are doing both, taking the best of both worlds. We'll be going through what is Hijama, cupping therapy, the history of the science, the difference between Hijama, cupping, the theory behind it, from traditional medicine perspective. So here we would be looking at it to make you an expert, to make you understand why you're different from every other person who practices cupping or Hijama. So you know how those cups, where you're putting them, is linked to the 12 meridians of the body. The special meridians, you know the way it relates to the body based on the humors and the principles of Unani medicine, which is also Islamic medicine. So you would see this, so you're more informed and you understand the why and the what, the who, all the questions that comes in the how of it. And you're one step forward above the other people who just copy and paste. You will get to know the organ systems of the body, both from the traditional medicine approach and from the Western medicine, the biology that we do in school, how they see it and how we see it. Safety in your workplace, teamwork. You learn the basic concepts of physiology in traditional medicine, diagnosis, identification and collection of the plants, how you dry them, how you process them, how you store them, and co. So you'll understand these things that we're bringing out here. I'm bringing some of these definitions just to let you understand, build the foundation. Like I said, today is the first class, is the foundation class, so introduction class, so you know. And if you have any questions, please send through the group, or you DM direct, or you send an email. We would answer you in the class, so other people who might have those doubts or needs would be answered too. So cupping or hijama therapy is a therapy where a cup is applied to the skin surface to cause local congestion through negative pressure, and blood is drawn from these locations where the cups are placed. These cups could be animal horn, like you see here, especially in northern Nigeria, glass cups, which is one of the China standards, plastic cups, which is now what is most popular, bamboo cups, metal cups could be those made out of aluminum, copper. Copper cups have been used for special treatments because of certain properties they have. China cups made out like those clay kind of pots that you see, and there are a lot of other cups that are there. You know, like I've already explained, nobody can tell you when Hijama started and like that, but you've got the seal of this Nabi Sallallahu on it that tells you it's a Sunnah. So, what you'll be learning about all these things, whether it's cupping, what you'll be learning about the traditional medical science, is that these are based on the temperamental theory. In traditional Chinese medicine, you hear them talking of yin yang, or in Islamic medicine, they're talking of bard and har. Traditional African medicine, they do talk about hot and cold. So sickness can only be either hot or cold syndrome. And then it starts, differentiation of syndrome comes in, whether it is hot, dry, hot, damp, cold, dry, cold, damp, and to what level of dampness or dryness, and how it affects the organ, and why is it called cold syndrome or hot syndrome. These are all things we'll be looking at with the temperamental theory, which we'll go through in detail. You'll be introduced to the preparations of herbs, consultation and diagnosis, understanding test results. Your patients, a lot of patients will come to you from the hospitals because they've tried and tested and it didn't work out. They tell you they said he had gastritis or they found H. pylori. And to you, those are really not, the test is more for reference so that he knows he's better when he goes to do a repeat test or a confirmatory test. But you should be able to diagnose all those things based on what you would see from the patient's eyes, the tongue, the lips, the hands, the facial expression, and what the patient tells you, the history the patient will give, what he or she will tell, and what answers will be given to your questions. You do the practical classes. You would know what aftercare to be given. You will also learn how to keep your records properly, how you design your hospital forms, how you make your filing, how you write out what you need to write out. In any language, like I said, you can write all your patient's history in Hausa or in French or in English, in Efik, any language you like, you write and move on. So, and like I said, it's a comprehensive course. There's so many things you would learn, certain copying for specific ailments and for general things, how your hospital or your clinic area should be kept, the kind of hygiene level that is expected, some superstitious beliefs and things that are true that you now come to learn, how to dispose the materials you have used, clinical best practice, business best practice, and the treatment protocols you should use where you're treating people with various ailments. Like we said, there are some ailments that we're going to look at. So how do you treat this patient and what combinations can you do? So, there'll be those practical classes that we'll end up doing and like that. Among the ailments we'll be discussing in class for this program would be inclusive of these, but not limited to them. Some of them we will touch on, and some we would prefer solutions and tell you how to get medication for. Headache itself is not a sickness except if it extends to the form to the sickness. It's normally an alarm that comes up that there's a problem somewhere. So some people just being hungry gives them a headache. Once he's hungry, he gets headache. Once there's an imbalance in their mind that they're angry or unhappy, they get a headache. So you see, headache could come from the metaphysical, mental side. It could come from the physical side. This is not even an ailment. If you have a boil, you could get a headache. If you have a fever, you get a headache. And so many other things give headaches like that. So it is an alarm. And you now try to find out what is the cause of the alarm. And once you sort that out, you go up. We'll be treating blood pressure related here. While we put it as blood pressure because some people have high blood pressure and others have low blood pressure. So we'll be looking at both of them. Asthma, we're trying to take those common ailments. Stomach ulcer, everybody's crying of ulcer, but they don't want to tell us what they did to cause it. Arthritis is getting common now because of our diets. So you find out that our lifestyle causes young people in their 30s and 40s, some even in their late 20s, to start complaining of arthritis, and you're wondering why it used to be an old man's sickness, and now even the young ones have it. Back pain, knee pain, memory-related problems. Erectile dysfunction, we'll be looking at that because you find it is now too getting very common, where you find young men who should be very agile and strong in their mid-20s or late 20s, early 30s complaining of erectile dysfunction, not to mention those in their 40s and co. Muscular issues, digestive issues, fertility. You find young ladies now in their 20s complaining of fibroids, not being able to get pregnant and things like that. Diabetes, cancer, and some other ailments which would come up in the class discussion that we'll be looking at. So we'll be, at the end of the day, looking at this intervention. So the definition of medicine in traditional medical science is that any intervention aimed at promoting health, prevention of disease, diagnosis, and treatment of physical, mental, and spiritual ailments by qualified practitioners, so not qualified practitioners, which is what we're trying to build here now. So you see, any intervention aimed at promoting health, prevention of disease, diagnosis, and treatment of physical, mental, and spiritual ailments. I have seen cases where people were on hospital bed, claimed they had fever. They claimed because at the end of the day, it looked like it wasn't fever, it was just the fever was in the pocket, where somebody would come visiting and said, you're sick. Yeah, I saw you. Here's this money. And the moment he just got 50,000, he discharged himself from hospital because all the fever had to do with the fact that he didn't have money. So we find out treatments, like we said, could be herbs, it could be counseling, it could be solving the problem the person has. And so we find out mental health comes in to this, where people are depressed. Depression is not because the person wants, it's just because the person hasn't got the solution or has not seen the solution or cannot find where to have peace because he or she doesn't have the solution. So the person goes inwards and depression comes in. But solve the problem, and inshallah, you find out that the person will be healed and healthy and back to normal like that. So we've talked about most of the things that we would be going through in this class, like I said, and inshallah, we would be breaking the class into those various groups. And in the groups, the class timings will be given so that we would generally agree for a time that will be for the live classes and for a time that will be for the offline classes. And we will do all that, inshallah. And like I said, we would be looking at a number of things that we will go through for those doing Hijama in traditional medicine. The various modules will be broken down and given in class and like that. So we would be stopping class here today, introductory class. Like I said, if there's any question, if there's anything that you need to clear, please do talk so that we will be able to answer you and clear it. And I pray this is the beginning of a march towards wellness, healing, solving people's problem, and being the best we possibly can. I pray Allah subhanahu wa ta'ala blesses our knowledge and makes it useful to us and to those around us and to the society in general. And Allah protect us from any knowledge that we will have that will not be useful to us or to other people who would need such knowledge. So thank you very much for attending today's class. Look forward to seeing you in the next class. Have a great day.